take a gap, and then go through this about the try reading this writing subtest details. If Trisha, if you can please loudly read the first few lines.
About the writing subtask, the
Mhm.
writing subject test is 45 minutes and is profession specific. There is one task set for each profession based on a typical workplace situation and the demands of the profession. A nurse does the task for nursing, a dentist does the task for dentistry, and so on.
Okay, then Clarissa, the writing test structure.
Along with the writing, sorry,
This
the task is
the
to write a letter,
Yeah.
usually a referral letter. Some alternative letter types are a letter of transfer and a letter of discharge. A letter to advise or inform a patient, carer, or group is sometimes used in pharmacy, veterinary science, and occasionally for speech pathology and occupational therapy. Another task variation with a different focus is a written response to a complaint for radiography. Along with the task instructions, you will receive stimulus material, case notes, and/or other related documentation, which includes information to use in your response.
Perfect. Then Kailian, how is writing ability assessed in OET?
Your performance on the writing subtest is marked independently by a minimum of 2 trained assessors. Neither assessor knows what scores the other has given you or what scores you have achieved in any of the other subtests. Your performance is scored against 6 criteria and receive a band score for each criterion.
Okay. So in this speaking task, you had 9 of them, 4 of linguistic and 5 of your clinical communication criteria. Okay. In the writing task, you have in total 3, 4, 5, 6 of them. Okay. The first one is purpose. Yeah, Kailian, please continue.
So purpose, whether the purpose of the letter is immediately apparent to the readers and sufficient expanded in the course of the letter. Content, whether all the necessary information is included and accurate for the reader. Conciseness and clarity, whether unnecessary information is omitted so that the letter is an effective summary for reader. Green and style,
It is genre and style.
genre and style,
Mhm.
whether the register, tone, and use of abbreviations are appropriate for the reader. Organization and layout, whether the letter is organized and well laid out for the reader. Language, whether the accuracy of the grammar, vocabulary, spelling, and punctuations communicates the necessary information to the reader.
Okay. See, whatever you may write, like the way you were speaking about the role plays and all, on the role plays and all, so you got to be meaningful enough. So suppose if you're writing a referral letter or a letter of transfer or a letter of discharge, after having put the salutations and greetings, the first sentence you will make should highlight whether it's a transfer letter or a discharge letter or a referral letter. Okay, so if you're writing a discharge letter, you simply would say that Mr. ABC is now ready for discharge, and she will be taking further treatment in your clinic. This will be possibly the first sentence of your letter, actual sentence. Once you put the greetings and once you put the address, once you highlight the who the addressee is, okay, then the content, the subsequent part, the second or third and fourth paragraph would make the content, whether what kind of treatment the patient has gone through, uh, right, under your care, under the hospital's care, or under the clinic. Okay, so there is a way to write about it. We will come to that. Then we'll come to the conciseness and clarity. Now this is the most important aspect, whether unnecessary information is omitted. See, if you have seen the case note of the task from yesterday, I hope you at least have gone through the task, the writing task I gave you yesterday. If not, then just we'll see. This one here, it is Jacob McCarthy. Uh, yes, is it visible to you?
Yes, sir.
Right. So for any like in any particular question, you will come across such case notes. These are all in blue are the case notes where you have the details of the patient and social background on admit, like the treatment given on admission, medical progress, nursing management, assessment, and discharge plans. Okay. So if you look back at the point here, it was the conciseness and clarity. So when you look at such a dearth of case notes, you think that you can't put all of it in your letter. So you got to be careful, just because you have to understand the kind of issue the patient had, and the thing which he was presented with, and the kind of treatment he's got. On the basis of that, you can use his social background, okay, his medical history, okay. In, like, what I'm trying to convey is that you have to relate each and everything, and then discard the things which are not necessary at all, okay. And obviously focus on the discharge plan, because the patient is going to get the further treatment under the person's care, okay, or the next department, or the next staff's care, okay. And then we see the next point, which is genre and style, whether the registered tone and use of abbreviations are appropriate for the reader. Like this like a few minutes before, when Tricia was accompanied with her daughter, and she was not having she was suffering with certain illnesses. You have to change the tone. In the similar fashion, when you're writing, you have to maintain the tone as well, right? You got to be polite. Suppose if you're requesting something, so you simply say that it is requested that Mr. ABC's vitals should be taken on a daily basis, like that. So you have to maintain it. And obviously, genre here means, suppose if you're writing a discharge letter, you will have to highlight the plans, so by suggesting putting phrases like the care must be taken, it is advised that, it will be important too. All such phrases I'm going to help you with while you will write the letter. Okay. Then you have the organization and layout. When you come to organization and layout, it's not a simple letter like you write to your friends or your family members, or any particular person. It's a professional letter. So we have to look at the organization and layout. If you can look at this simple answer, you will understand what I'm trying to say. This is one simple letter. Okay. So you know, you have to put the name of the person whom you're writing to. Okay. Then the date, then the salutations. Okay. And then the subject reference, like this Jacob McCarthy is the patient. And then you will structure your paragraphs 1, 2, 3, like 4. So when they say organization, so this is what the structure is, the organization is. Remember, you got to leave a gap of a line when you write the addressee, when you put the date, and then when leave a proper gap of a line in between the paragraphs as well. Okay. In Malaysia, what kind of center you will be having? Like, are you guys going to write a computer-based test or a pen and paper test?
Most probably a computer based.
Computer-based.
I think I will sit for a pencil base.
Okay.
Base.
Yeah, pen and paper or whatever. So just be careful, because a teacher may not say that you should use a good handwriting, but it is very much the part of your answer, your his a teacher examiner's perspective. Because if you're going for a pen and paper test or a pencil paper test, you got to present your answer in the best way you can. You're allowed to use eraser. So just be neat, just try to maintain it neat and clean, and then you submit your answer. Okay. And then once you close it, you put a closure. This is a closure. If you have any queries, please contact me. And then you will say yours sincerely, and at the bottom you will put doctor. That's it. All right.
Sir, actually, how much time do we have to write this referral letter?
How much time?
Yeah.
You'll get 45 minutes in total.
So
And
do we need to write like a very long paragraph or just in brief?
185 words, 180 or 85 words. You can assume like writing 10 to 15 words more, let's say almost 200 words.
Okay.
Just because, you know, the first, you see the first 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So this first 9 or 11 lines, actual lines of your question answer booklet, you can easily fill, because you know these things can be memorized, or these things are pretty general. And even the purpose, the one here is Mr. McCarthy was admitted on 6th April. These dates will be given to you, the admission date, with a right diabetic foot ulcer, the condition he was presented with. A vascular surgeon was consulted, so you've been there, let's say, you who recommended that he undergo right below knee amputation, which was performed without. So this thing has already been carried out. So the purpose is already clear, right? If not, then you simply say that if the discharge letter, so you may simply say that Mr. McCarthy was is doing well now, and he is ready to for discharge under your clinic, under your care in your clinic. So it could be a one sentence answer, purpose. I'll help you with it with the same, not to worry. Okay. And so first 9 or 11 lines you can easily fill. Similarly, last few lines, like writing the doctor here, yours sincerely, and if you have disclosure, if you have any queries, please contact me. And obviously the last line of the last paragraph, we feel that after some time at your facility he may show sufficient improvement to return home. These are pretty normal general sentences, you can say. Okay. So
Okay.
the point here is, at least you know the structure, and once you're aware of the structure, you are there. Okay, regarding the paragraphs, like the body paragraphs, the ones here, obviously like the purpose as well, and then this one, we will have to work on these mainly. But I would expect that you at least remember these lines. Okay, for now. All right. Okay, so I hope you have taken the screenshot of this, and for the question as well. You have taken the screenshot of this?
Yes, sir.
Yes, sir.
Yeah, let me, yeah, this is better one, and it is complete here as well. Take the screenshot of this and the question with the case notes. And you guys can write, you guys can speak, but like in what way we should speak or in what way we should write, we are working on that. So you keep the screenshot of this, and now we'll quickly see, like, am I like, missing some point here where I